And so what we're looking at is essentially people that will test normally, just like the rest of the populations, on a psychiatric profile, who have just one way or another developed patterns that resulted in them becoming obese. And so it's hard to identify individual problems that you can correct, and this is why non-surgical weight loss in these very heavy people just doesn't seem to work.
George, some people will recognize your name. George Argyris, famous billionaire businessman, member of the Forbes list. You're his son. Is it easy street being the rich kid?
You know, Rick, it would appear that it would be easy growing up in the environment that I did, but all children, most families have issues that they deal with. Some of them are different than others. Our family had issues. I had issues as a child, and I dealt with them as so many of us do in today's world, and that's through food.
So in your case, do you feel food was an addiction?
Addiction may not be the right word. It was the emotional solution for whatever I had going on inside of me at the time, and that started at a very early age in my life and went all the way up until my mid-30s.
Now that you've had this surgery, do you ever feel that urge that, you know, gee, it'd be nice to just sit down and have a pizza or you know, a pumpkin pie or something like that?
Well,
I'm naming a few of my favorites.
Sure. And just so you know, I do have the luxury of still having those pizzas and pumpkin pies. They're just in very small portions. The only thing that I can tell you is, yes, even after the surgery, that drive to Del Taco for the double Big Del in the middle of the night to solve whatever emotional trauma was going on inside of me was quickly replaced on the cool list with me standing outside of the car right after the drive-thru throwing the burrito back up. So you just don't have that luxury anymore.
At this point, you just can't be fat anymore.
You just can't do it. No, sir.
Now, is there a downside?
You know, there is a downside. The first one, I think, is with any surgical procedure, there's a risk. Second one is there are some inherent things that come along as risks out of the gastric bypass surgery. But for most people, they wouldn't experience this. I think some do. It is a huge life-changing deal, and you end up a completely different body. So maybe the same emotional person, but a different body than you were.
How has it changed your life?
People look at you completely different. People address you differently. People, you know, you're viewed differently by everybody.
Were you aware of that before you had the surgery?
I was not. I led a pretty normal life. I mean, I played basketball, not very well. I dated fairly good-looking women. You know, I water skied, I snow skied, I had good friends, I went to fun places. But in hindsight, it was all greatly reduced by the weight that I was carrying.
Doctor, a lot of talk nowadays about obesity. People say it's an epidemic. I think you referenced it. Is there some hype, too, though, to this? Because, after all, people are living longer. By many measures, there are more healthy senior citizens than there have ever been. Is it just